the spine and major blood vessel. There was a mass. It was biopsied. It was proven cancer. And he heard about this material called CanCell. And it's some kind of magnetic material, and you're not supposed to put one bottle of CanCell next to the other one because it will do something to the bottle. And you're supposed to take this medicine every 6 hours to kill the cancer. And he took it every 6 hours for 18 months. He never did another test. He did this CanCell every 6 hours. You can imagine that's like 500 days, so it's, 3,000 doses, and it's not inexpensive. And now he has a new scan, and the cancer's growing. So he came to me as a second opinion, and I said, well, I don't think you need to take that medicine anymore. I think it's not working. I think you have proof that it's not working. And then I looked online, and actually in 1978, the FDA issued a report saying that it had no beneficial properties as a cancer agent. So it's kind of like George Washington, and we keep on learning again and again and again that there's things out there, and just because people say it's going to work, where's the proof? We need the proof. So this man, unfortunately, has now a bigger tumor, bigger cancer. He took a year and a half of this medicine. It didn't work. I'm sure it was inconvenient. And I believe he's going to go ahead with radiosurgery. We talked about chemotherapy also because it means that the cancer was not cured by his surgery, that cells got out of the area into the bloodstream to spread to the lymph node. So I believe he's going to have 5 treatments with radiosurgery, and we're talking about other treatment to him. And most likely, we can't guarantee any results, but most likely about 90% chance where we hit the cancer, most likely we can stop it or shrink it or make it go away there.
Were his symptoms worsening over these last 18 months while he was on CanCell?
No, he has no symptoms. He's a very distinguished businessman. He travels around the world lecturing, and he's a lecturer and a businessman, and he's fully active, very distinguished gentleman with no symptoms, but a cancer growing deep in his body, and unfortunately on the wrong track up till now. I hope that we're able to give him what he wants. We also had another distinguished man who had bladder cancer. He's 90 years old, came in with bladder cancer, a suit and tie, worked all his life, brought in by his loving son, and had a superficial bladder cancer. It was scraped off, and superficial treatment was given for the last 3 years, and now the cancer is invading into the muscle. So it's gone from a superficial precancer to an invasive cancer. And he wants to know if he has a chance with us. I told him he has a great chance with us. I asked to stage him. Stage him is a way to find out where the cancer is. So we're getting a PET CT scan of his whole body, and then he's coming back, and we're probably going to use a form of focused radiation that we're famous for, and a little chemotherapy to sensitize the cancer to the radiation. And then I had him take off a Band-Aid. He had a Band-Aid on his forehead, and he had a skin cancer that was about a half an inch on his right forehead. And I said, we're going to do 2 for 1. He asked, can you hit that also? And he didn't want surgery. He thought surgery would be very deforming on his head, and it often is. And so we're going to do 2 for 1. I told him he doesn't even have to pay for the second one. It's kind of it's 2 for 1. And most likely we'll be able to put both of those in remission. Can't promise it, but we have a good chance of that. And we treat a lot of skin cancers around the face, especially around the eyes, nose, mouth, and ears, because those organs are really hard to recreate with surgery.
And people don't want surgery on their face just because, like you said before, it'll be deforming.
Well, some people want surgery on their face. If you walk down the street in New York, you see a lot of people having surgery on their face. So some people are seemingly craving it, and other people seem to be wanting to avoid it. I'd want to avoid it if it were me.
So I understand that.
Okay, so there's new information about kidney cancer also now. There's been several active agents. One is Sutent. These are biologic agents for kidney cancer, and Sutent, S-U-T-E-N-T, has been the traditional treatment in the last few years. And there's another treatment that has shown some promise, Afinitor, which is another biologic agent for kidney cancer. And no one knew which is the better agent. So there was a randomized study that looked at patients. It was a phase 2 randomized study that compared people with kidney cancer and no prior systemic treatment. So they were kind of virgin patients. So obviously virgin patients, meaning no prior chemotherapy, tend to do better than those who have had lots of chemotherapy. And the patients were randomly allocated to either Sutent first or Afinitor first. And then when the cancer progressed, they got the other agent. Okay, so either Sutent first.
Backup choice.
Yeah, backup. So Sutent first and half, Afinitor first and half, and then if it didn't work, they progressed on to the other one. So it's interesting because lots of these studies that we talk about, there doesn't seem to be much difference, a month or 2 months. But actually, in this case, there was a year difference in survival. So whether you took one drug first or one drug second could give you a year difference. So it's pretty impressive. And actually, it was Afinitor first was 22 months survival, median. And if you took Sutent first, it was 32 months. So here's a case where a study is important, and we learn from the study. And so for kidney cancers, these are virgin patients, never been treated with chemo before. It's better to have Sutent first than Sutent second. And there were adverse reactions. Some were irritation in the mouth, diarrhea, cough, edema, constipation. So it's an interesting study, and it was presented at ASCO. ASCO is the National Cancer Meeting for Medical Oncologists this year. So this is new news. We also treat a lot of kidney cancer because radiosurgery is so effective for kidney cancer where we aim the beam. So what do you think about that?
I think that I'm not going to ask the mechanism because it doesn't matter. Like you said before, the mechanism doesn't matter. The results matter.
Yeah, it's the results. The proof of the pudding is in the eating.
Yes.
Folks, we're almost at the end of this show. Our next show is on ABC Saturday morning at 6:30, WABC 770, and then we're back on WOR Sunday morning at 6 to 7 and WOR 9 to 10 Sunday night. You're welcome to call us at our office number, which is 212-CHOICES, 212-CHOICES, which is 212-246-4237, 212-246-4237. We have a booklet and a DVD, which we'll send to you at no charge about our work. And if you have questions or issues and you want to call during the week, call during the week that number, and I'd be happy to speak with you. So thank you, Ariel, for being my co-host. I want to thank the staff here, Mike and Noah, for running the show. And to all the listeners, thank you and have a fantastic week.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.